test, right? So first of all, you have to wash your hands, apply gloves, right? And then we're doing test, right? Okay, come on in, come on in, come on in, come on in. Okay, yeah. Okay. Usually we're removing these things. I know later. I mean, next time, not to interfere with our job, right? Okay. Okay, guys. So you have this paper. It's a paper for a practical thing, right? So you have to write the patient name, Ray Nikolai, right? Age, date of birth, and date and time for today, right? Today is uh, February 28th, right? 17, and time is 18:20. Okay. Okay. So now we're using method to detect substances in the urine. Okay. How we call this method? It's written here. Reagent strip method. Okay. So it's reagent strip method, right? So it's screening test. What means screening test? Screening test means that it's easy to be done. Every day, medical assistant doing this test is number one. Number two, it's very cheap. That's why we're doing widely for every patient that complaining to having problem with urinary system. And it's not expensive. That's why we're doing this every day. People coming, for example, they're complaining of frequent urination, pain on urination, or burning sensation on urination, right? So this is a sign of urinary tract infection, infection of urinary tract. In this case, we have to do this test. It's screening test. Screening means quick test, right? Not complete test. Besides, it's a screening, and it's we have quantitative test and qualitative test. This is qualitative test. Qualitative, right? So what is qualitative? From the word quality, качество, right? It means that you detect some substances, 10 substances in the urine, only detect them. So it's quality test, qualitative test. We're not calculating amount of this substance in the urine. This what doing laboratory technologists and technician in the lab. They will do complete urinalysis. This is not complete. This just screening means you have to find out what substances you have in the urine, and that's it, right? That's why it's cheap. That's why it's quick, and we call it screening, and we call it qualitative. Besides, we have quantitative test. Quantitative. What means quantitative? Means quantity. Quantity количество. Да? То есть мы делаем качественный тест. Right? And in labs, they're doing quantitative test. Количественный. So they will detect not only the substance, they will detect amount of the substance in the urine. Okay? So this is more complex test, more expensive, but if doctor considering to do it, you will send this urine to the lab for confirmation. So if you don't see anything here, right, we're saying the test is negative and it's good. And if doctor not saying you anything, you're not sending this test for lab. But if you find something in the urine, for example, protein or sugar or something else, it means the test is positive. Positive means you found something in the urine. If you found something in the urine, so test is positive, you have to send it to the laboratory for confirmation. Clear? Confirmation. This will be on the table, this page. Okay, what means confirmation? If you found something in the urine not good, protein, sugar, or something else, It means the test is positive. Positive is not good. It means that you found something in the urine. If you found something, you have to send it for confirmation urine to the lab. So is it clear? Good. Okay, so to detect something in the urine, we have reagent strips. That's why we call this method reagent strip method. It will be on the table, and you will be looking at this paper, and you will doing the same thing that I'm doing right now. Okay? Okay, reagent strips. So we have strips, urine strips, right? So these urine strips will have different colors, right? They will have lines with different colors. Every color is related to every substance in the urine, right? And you will have bottle. So these strips belong to this bottle. You don't have to use other bottle and this strip. Only this strip and this bottle. Okay, every time like this. For example, if strips will be over finished, you have to discard this bottle. You don't have to use it anymore. Okay, clear? То есть соображение сбережения тут неуместно. Мы ничего не сберегаем. Okay? If it's over, you discard it and you use a new bottle with strips and new colors. So what are you doing? You have to compare the color on the strip after you placing the strips in the urine with the color on the bottle. You have different colors. You see these colors, right? Okay, first row of the colors, first row, it's normal urine, normal, or control, right? And other colors, it's not normal, abnormal. So if you see other colors, means you found something in the urine, right? What you can find in the urine? 10 substances. It's written on this page, right? So what are these substances? First of all, leukocytes. You see here leukocytes, right? Leukocytes, you see here. It could be positive or negative, right? So if it's negative, it's okay. You didn't find leukocytes. If it's positive, it's not good. Means you found leukocytes in the urine. It should not be in the urine. Because if you're finding leukocytes in the urine, it's a sign of infection. Okay? It's a sign of infection. And you will write, for example, if you sign leukocyte, you will circle it positive. Okay? If you didn't find anything, you circle negative. Okay? And it's written here. If you find leukocyte, it's indication of inflammation and infection. Now, next it's nitrites. Но это не те нитраты, которые обнаруживаются в овощах и фруктах. Okay? It's nitrites, right? Again, it's a sign of inflammation. If you found it, it's a sign of inflammation. Okay? Nitrites. So again, if you found something, so changing color means it's positive. If you didn't find something, it's negative. Okay, all of this first row, it's okay. It's negative. It's normal. Other, it's positive, right? If you find something. Next is protein. You know, right? What is protein? Yes. What is here? Here it's not protein. It's urobilinogen. No, it's yeah. Number 3, it's urobilinogen. Okay, urobilinogen will be present if patient developing jaundice. Okay, of course, everybody in this room not having jaundice, so of course urobilinogen should be negative. Urobilinogen it's a particle that derived from bilirubin. Bilirubin could be positive on jaundice too, number 9, right? So next is protein, like I told you. Protein should be negative. in the urine. If protein is positive, it's a kidney disease. You see, kidney disease. Okay? Now, pH. What is pH? pH could be from 0 to 14. From 0 to 14. If it's in the middle, 7, it's neutral media. Means the urine is neutral. If it's 6, 5, and 4, 6, 5, and 4, it's acidic. So acid in the urine. If it's 8, 9, and 10, it's alkalinic. So shortage in the urine, alkalinic. Okay, and 7 is neutral. So if you have 6, it's okay, because if urine is acidic, means it will be killing all microbes. So it's better when you have 6. And it's not dangerous, but it's predisposition to infection if you have 8, 9, and 10. Okay, next. Next is
Blood.
blood. No, you know, when people developing blood in the urine, first of all, of course, tumor. But second of all, it's stones, right, in the urinary system. If people having stones moving, we're irritating the mucous membranes, and we will have blood in the urine. And one more, it's infection. Infection, stone, and cancer. So if you see blood in the urine, it's absolutely not good. But girls, you know, they could have blood during periods. So if some of you having periods, you will not doing the test today. Okay? Okay, next.
Это я.
Я так и знал, что это будет Ирина. Я даже не сомневался ни на одной минуте.
Так получилось.
Ну, я понимаю, Алена, так получилось, все ясно. Так, поехали дальше. Specific gravity. So what is specific gravity? Удельный вес мочи. Okay? Specific gravity, you have put numbers. For pH, you have to put numbers. For proteins, you have to put numbers. For blood, it's just amount, positive or negative. For specific gravity, you have to put numbers. You will see what is number. Number for specific gravity, SG, will be from 0.1.003 dash 1.030. This is normal specific gravity, right? If you have these numbers, it's good. Okay, specific gravity is good. And this test, okay, let me see. Okay, okay, usually they say 10 parameters. You see 10 parameters, right? It's written 10 parameters, 10 things. But one thing, specific gravity, it's physical thing, not chemical. Other things are chemicals. Okay? That's why sometimes you will see 10 SG test, right? So what means 10 SG test? Means 10 parameter from which one is SG, specific gravity. Okay? Okay, next. Ketones. What is ketones? Ketones, it's substances appearing in the urine when we have complication of diabetes mellitus, sugar disease, right? If people developing complication, they will developing ketones. One of these ketones is acetone, по-русски ацетон. Another, it could be special bodies resembling the ketones, resembling the acetone, right? And they will be present in people having diabetes. If you see ketones in the urine, you have to send this patient immediately to emergency room because it's complication of diabetes. Next is bilirubin. What is bilirubin? I told you, jaundice, right? Jaundice is желтуха, yellow discoloration of the skin and mucous membrane. And finally, sugar. When we detecting the sugar, when people having diabetes, correct? Diabetes mellitus. So this, what are you doing and how you doing this? Okay. So let's start. I took the strip, right? This, я знаю. Но мне не нравится, что он розовый колор. Тут не должно быть розового цвета. Ну ладно, почему-то розовый, не все розовые. Ну окей, ладно. Сейчас посмотрим, что получится. Николай, не волнуйтесь. Вот, все может быть. Все может быть. Поэтому, может, ну тут написано июль 17. No, it's okay. No, sometimes it could be not good color. Okay, guys, so what do you do? First of all, glass. Second of all, you're opening the container, right? Okay. Then you're placing the strips into the container very quickly, like this, right? Very quickly, like this, right? That's it, right? Then what are you doing? You're removing excessive amount of urine, like this, right? Then you're placing on the paper, and we have to wait 2 minutes. Okay, we have to wait 2 minutes. So, how long you have to wait? It's written here. 2 minutes, 60 seconds, 30 seconds, but you have to wait 2 minutes, right? Then we will be reading result. Okay, then we will be reading result.
Первый здесь или здесь?
Здесь. Mhm. Okay, you see this is blue, right? Blue at the bottom, right? Okay. So we're waiting 2 minutes. Meanwhile, you understanding what are you checking, right? So everybody checking for your friends today, right? So I gave to everybody cups. You go into the bathroom, you bring in the urine, and your friend will check it for you, right? So at this or later, don't be distracted. So at the upper portion, you write patient, age, date of birth, date and time, right? And then, guys, you see you have these two things, color and clarity. So yeah, I will explain you later. This is a physical examination of the urine, color and clarity. What is color? Yellow. You write yellow, right? Clarity, clear. So you write clear, right? And then 2 minutes already gone. We have to uh, do these things, right? So, first of all, no, because it was pink, so I think it's negative, right? Negative. So you're writing this negative, right? Then nitrates. Nitrates, it's of course negative too. You see this color, first color, right?
Yes.
First color, right? You're comparing. Guys, do not touch it because urine is here, right? Next is urabilinogen. No, it's strange color, and I don't think it's good. Its strips are not good, so it's negative. So nitrites are negative, urabilinogen are negative. Next is protein. Protein is this one, number 4, right? So number 4, you see it's negative, right? Negative. So you write negative. Protein, it's negative. Next is pH. pH should be numbers. I told you, right? Should be numbers. So it's number 5. 1, 2, 3, 4, 5. So it's something here, right? Something here between this and this, right? Slightly green. pH slightly green is here, right? So and you see the number. Number is 7. So it's neutral, right? pH is number 7, right? So it's neutral, right? Okay, this will be on the table. Next, it's about blood. No, blood, of course, should be negative, and it's negative. First, right? It's negative. Next is specific gravity. Okay, what is specific gravity? It will be close to this one, right? It's number, and it's 0.25. Okay, so specific gravity numbers, right? Blood is negative, right? Specific gravity 0.25, right? And it's normal. You see? Now ketones. Of course, ketones should be negative, right? Okay, it's negative. Now, bilirubin. Of course, it's negative because bilirubin is a sign of jaundice. And finally, glucose, it's negative, right? So you write ketones negative, bilirubin negative, glucose is negative, right? So, and then you writing your name, Koля will write name, right? And signature. Name of medical assistant, right? Your name. That's how I will be know who is doing this. So you have to clearly write your name and then signature. Right? Conclusion. Normal urine. Okay? Normal urine. Okay, guys.